Is Montreal moving towards a privatized healthcare system? Montreal is experiencing an understaffed healthcare system. Many workers are leaving the public system to work in the private one. Patients are experiencing long wait times for essential services or to be paired with a family doctor. These issues are province-wide, with lack of access to a family doctor being one of the most notorious issues. More than 800,000 Quebecers are on a waiting list to be assigned with a family doctor. Last September, Quebec's provincial government proposed opening 2 private clinics, one in Montreal and one in Quebec City. Health Minister Christian Dubé said that this would help alleviate emergency rooms. The clinics are intended to be running by 2025. Privatization is argued as a good method to alleviate long wait times, save money, and increase the capacity of healthcare services. With a private healthcare system, public dollars would then be reallocated towards a for-profit model.
These are public funds that are going towards for-profit clinics that are shareholder owned. So when shareholders invest money into these clinics, they're paid a return on their investment. And that's a private for-profit investor-owned facility. That's one of our concerns, is that public taxpayer dollars are going towards these for-profit clinics and are going into shareholder pockets, when that really shouldn't be the case. When we know the solution is publicly funded healthcare and not-for-profit clinics, where the money that goes into these clinics goes towards patient care, goes towards the staff that runs the clinics, and not towards shareholders who really don't see the patients at all.
In a province plagued by lack of access to a family doctor, long wait times in emergency rooms, difficulty obtaining appointments or accessing clinics, and patients no longer accepted at walk-in clinics without an appointment, Montrealers are eager for timely healthcare. Less than 70% of Montrealers have access to a family doctor, while 800,000 people in the province are without one. According to Quebec's healthcare department, as of February 2021, the average wait time to access a family doctor in Montreal was between 604 days and 862 days. Local 514 has been in contact with multiple sources who have been waiting between 4 and 9 years to be paired with a family doctor. Reports from last summer show that money Quebec has spent on private healthcare workers has increased by 335% in the last 5 years. Due to labor shortages, the Ministry of Health and Social Services have been obligated to hire healthcare workers from the private sector. In a document leaked to the CBC, a 90-page plan was detailed by the provincial government, intending to revamp the healthcare system by 2025. The government will address reliance on private agencies to use temporary nurses and nurses' aides in both long-term care homes and hospitals, which result in much larger costs than public nurses.
We already have a staffing shortage in the province and across the country, and that's one of the biggest factors causing significant wait times and surgical backlogs. And we don't have groups of physicians or nurses sort of just waiting to staff these for-profit facilities. And so when we do when the province eventually does expand to these for-profit facilities, as I mentioned earlier, it's just going to siphon resources from the public system and will likely worsen the wait times in the public system. Because why wouldn't physicians or nurses work in a cushier for-profit clinic where they could leave on time, where the cases are simpler, where they don't have to deal with complex cases? Why wouldn't they want to do that? And, I can totally understand that, but it's going to leave the more complex cases for the hospitals, and it's going to lead to further burnout from the public system and from the worsening the wait times in general.
Some doctors have left the public healthcare system due to being overworked during the pandemic or wanting to be compensated with more money for their work. Dr. Saba said that there can be ways to incentivize doctors in the public system to take on more patients.
We can incentivize. There's always ways to incentivize. There could be tax credits, for example, if physicians take on extra patients. Physicians who are in group practices, GMFs, there are already incentives. So that could be another thing, is to bring in the almost 50% or more of physicians practicing alone, allowing them access to help the healthcare system. So these are simple solutions that can be done.
Since many Quebecers won't be able to access a family doctor anytime soon, the province has begun assigning patients to a group of doctors, essentially meaning that they are assigned to a clinic. Emma Braley moved to Montreal in 2016, but has been in Quebec's healthcare network for her whole life. Her family doctor retired the same year she came to Montreal, but she still hasn't yet been placed with a new family doctor. Braley says that booking an appointment at a walk-in clinic has been difficult, but she's also experienced issues with over-the-phone appointments.
It truly is a call the day before, hope they have something for you the next day, and hope that you're free at that time. You really don't have any say or agency really in your own medical care.
Even when they have an appointment at a clinic, they may not see a doctor right away. Local 514's video journalist, Aude Simon, took a time-lapse of her waiting over an hour for an appointment that she had booked at a walk-in clinic. Her appointment was scheduled at 9:30, but she ended up waiting an hour in the waiting room and an additional 20 minutes in a consultation room until she finally saw a doctor. Out of the 5 appointments Simon booked at a walk-in clinic in 2022, they waited an average of an hour and a half for their appointments. She's even waited up to 2 hours for an appointment. But why can't Simon just see their family doctor? Because they've been on a waiting list for almost 10 years due to lack of availability in her neighborhood. Given the issues that patients face in the public healthcare system, should we just move towards a private system?
There's actual data behind some of these statements. There's studies done in the UK looking at outsourcing for-profit providers, which showed increased mortality. In the States, the same thing, for-profit hospitals associated with higher mortality rates. And even in Ontario, in the first couple of waves of the pandemic, we saw what happened with for-profit long-term care homes. And the evidence there showed that the mortality in for-profit investor-owned long-term care homes was about almost 80% higher than their nonprofit counterparts. So we know that patient outcomes suffer when for-profit investor-owned facilities are thrown into the mix.
Can we really rely on this model to serve people before profits? Let us know below in the comments.